1945 and 1964, an unprecedented number of babies were born in America. This generation has come to be known as the baby boomers. Although this is a diverse population, let's look at them as a group. The boomers came of age during the 1960s. They affected social change, witnessed great national tragedies, and now make up a considerable economic demographic. Think of some of the remarkable technological advances that have occurred during their lives. They watched the Kennedy-Nixon debate on their black and white console TVs, and recently watched the presidential election on flat-screen HD TVs. They played Beatles and Supremes albums on the hi-fi, and now have iPods. Boomers were there when the first calculator was sold for $2,500, and they now calculate, text, tweet, and download movies using touchscreen cell phones. They were in awe of the first massive computers and now use laptops with wireless access to the internet. The boomers have seen a lot of change in their lives, and more change is coming. In January of 2010, the first boomer turned 65 and will age into Medicare. The people who are now aging into Medicare have different expectations, learning styles, and experiences than older beneficiaries. They're better educated and are expected to live longer and healthier lives than the generations before them. Many will postpone retirement. The boomers are redefining what it means to age in America. Like their predecessors, they have important decisions to make about their health and prescription drug coverage. Decisions that will affect them now and in the future. Watch now as some boomers from Riverdale High plan their upcoming high school reunion.
Oh, I'm so glad to see you.
Good seeing you, too.
It's been too long.
Yeah.
You remember my husband, Bob? He graduated 3 years before
Of course
us.
I remember, Bob. How are you?
Fine.
Look at all of you. The years have treated you well. My husband Jim will be here soon. He got stuck in traffic. Should have used his GPS. And how are your kids?
The kids are great. They all live in the area. We have 10 grandchildren.
Whoa.
And one of our grandchildren is married. We could become great-grandparents soon.
Oh.
The prom queen could be a great-grandparent. How did that happen?
I don't know.
Oh, my great-grandparents? It's just not possible. I remember our 10-year reunion picnic. All of our kids, they were so small. They were running around the park. I think some of them were still in diapers. And now some of them are going to be grandparents. Where's the time gone?
Speaking of time flying, I just can't believe it, but I'm starting to get information in the mail about Medicare health plans and Medicare supplement plans. Grandchildren, great-grandchildren, and Medicare. It just can't be. I still work full-time, I play tennis every week, and I'm in good shape.
You know, I don't feel old either. I still teach art and dance at the community college. I even take a photography class.
Bob and I hike and golf. We may be old enough for Medicare, but we don't feel like senior citizens.
I agree. I don't plan to retire when I turn 65. I plan to work for at least 5 more years. So I'm glad I can put off doing anything about Medicare for a while.
No, you can't put it off. Before Bob turned 65, we started getting a lot of Medicare-related mail, too. We had no idea there were so many choices. I mean, we didn't realize that even though a lot of this mail was coming from private companies, it was still explaining different Medicare coverages. So we went to Medicare.gov. That's the official government Medicare website. We found out a lot of helpful information. I remember reading that there are some decisions you need to think about even if you do keep working. I mean, you can sign up for Medicare Part A even if you don't plan to retire at age 65.
Maria is right. If you aren't getting Social Security or railroad retirement benefits, for instance because you are still working, you will need to sign up for Part A.
Part A? What's that? And how much does it cost?
When I retired, I signed up for Social Security. I got a Welcome to Medicare package in the mail about 3 months before I turned 65. So I read through it and learned that Medicare Part A is hospital insurance and Part B is medical insurance. Now, most people don't have to pay a monthly premium for Part A because they or their spouse paid Medicare or FICA taxes while they were still working. I also learned that I would have to pay to have Part B. The monthly cost comes out of my Social Security.
But what about you, Maria? I know you worked hard at home with 5 children, but you never worked outside of the home, did you? Will you get Medicare coverage?
I wasn't sure myself. So I used the Medicare eligibility tool on Medicare.gov to see about my options. I answered a few questions about my specific situation, and they gave me information about my eligibility and enrollment. I found out that I will get Medicare because Bob paid into the system while he was working. I'm covered as his spouse.
In most cases, you have to work 10 years in Medicare-covered employment to get Medicare Part A at no cost. If you didn't work long enough to get Part A for free, you might still be able to buy Medicare Part A for a monthly premium. Social Security determines if you have to pay a premium for Part A.
I've had to learn a lot about Medicare too. I help my aunt and uncle make all their important decisions. I spend a lot of time reading the Medicare and You handbook they get in the mail every fall. I've even helped them make their coverage choices.
I have my copy of the Medicare and You handbook on my desk. Let me get it.
Okay. I also signed up for the Ask Medicare e-newsletter on the Medicare Caregiver site. It comes out every other month, and each edition really helps me to help them. And it's also teaching me a lot about Medicare. I feel much more confident about being ready to make my own Medicare decisions.
That's so nice of you to help them out. I guess when I'm about ready to turn 65, I'll read my Welcome to Medicare package.
Well, that's just it. If you keep working and delay getting Social Security, you won't get the package. It's up to you to call Social Security. They'll make you an appointment at a local Social Security office to sign up for Medicare Part A and tell you what you need to take with you. SocialSecurity.gov is a great website, too. Even though you're still working, you can sign up for Part A when you qualify for Medicare. But check with your employer's benefits administrator to find out how your employer plan works with Medicare and check your options. You can join Part B later, but be careful of the timing, or you could have to pay a Part B late enrollment penalty since you didn't join when you were first eligible.
Yes, Bob is correct. The timing of enrollment in Part B is a consideration. If Linda has an employer group health plan coverage, she can join Part B at any time while she is working, or within 8 months of losing her employer group health plan coverage, with no late enrollment penalty.
I didn't know there was a penalty. I'm so glad we're talking about this. It's not that I don't understand health insurance. I look at my coverage options every year during open season, and then pick a plan that my employer offers that covers my health and prescription needs, and one that I can afford. I like that flexibility. You never know from year to year what will happen with your health.
You are so right about how your health can change.
That's for sure. You know, Medicare gives you the same kind of flexibility. You have choices of different kinds of plans. You have the option to change your coverage in the fall each year, sometimes even more than once, like if you move out of the planned service area. My aunt and uncle have the fee-for-service option. It's called Original Medicare. They have both Part A and Part B. It covers a lot of their hospital and medical services and supplies. And they can go to almost any doctor and hospital, even when they're visiting my sister in Florida. With Original Medicare, they pay the Part B premium. There's also an annual deductible, co-insurance, and co-payments. They also joined a Medicare prescription drug plan, and they pay monthly premiums on that as well. When they get health care, they use their red, white, and blue Medicare card. It came in their Welcome to Medicare packages. They have a separate card for their drug coverage. Oh, and remember when Bob said there was a Part B late enrollment penalty? There's a late enrollment penalty for waiting to get Medicare prescription drug coverage after you're first eligible, unless your employer's drug coverage is as good as Medicare's coverage.
There are also Medicare Advantage plans, or MA plans, that are run by private companies. They cover all Medicare Part A and B covered services and supplies. Different plans have different costs and rules.
Linda, this is probably similar to the kind of coverage you have now with your employer. In an MA plan, you pay the Part B premium and you pay the plan premium. You also pay co-payments and co-insurance. Now, most MA plans cover prescription drugs too for an extra cost. They may cover some extras that original Medicare doesn't cover, like vision care. Look, there's a list of the plans in this area in the back of this handbook.
Plans can change each year, so every fall I compare my options and choose the coverage for the following year that fits my needs. We also use Medicare Options Compare to get more detail and up-to-date information about the Medicare health plans and Medigap plans available in this area. I also check the Medicare Prescription Drug Plan Finder on Medicare.gov to compare Medicare drug plans.
The best time to buy a Medigap policy is during or just prior to your Medigap open enrollment period. Your Medigap open enrollment period lasts for 6 months, starting on the first day of the month in which you are both age 65 or older and enrolled in Medicare Part B.
Okay, so now I understand that most of the mail I've received has been from Medicare Advantage plans. If I pick that kind of coverage, am I still in Medicare?
Absolutely. If you join a Medicare Advantage plan, you're still in the Medicare program.
What about the other mail I've been getting? What is Medicare supplement insurance?
Oh, I know that one. Medicare supplement insurance policies are also called Medigap policies. They're sold by private insurance companies to help cover the gaps in original Medicare coverage, like co-payments, co-insurance, deductibles. I helped choose Medigap policies for my aunt and uncle.
Generally, you must have Parts A and B to buy a Medigap policy. You pay a monthly premium for the policy and still pay your Part B premium.
Bob, I saw you had a copy of the guide to choosing a Medigap policy on your desk. Could you get it?
Sure.
I had downloaded it from Medicare.gov to use to try to figure out which plan had the coverage they needed. Then I looked at Medicare Options Compare to see which companies sold those Medigap plans in the state. Since the plans are standardized, the only difference was cost. We bought their policies when they were 65 and enrolled in Medicare. During that 6-month period, they were guaranteed to get the policies they wanted regardless of their health history.
Bob, do you have a Medigap policy?
No. Since I have a Medicare Advantage plan, I don't need and actually can't buy a Medigap policy.
Carol, didn't you tell me that your uncle will be moving into a nursing home soon? Does Medicare cover nursing home care?
Well, only in certain cases. Medicare covered his stay after his hip replacement last year at a skilled nursing home for rehab.
Medicare does cover skilled nursing care after a related 3-day or longer hospital stay. Skilled nursing facility care requires the daily involvement of skilled nursing or rehabilitation staff. The nursing home care Carol's uncle needs now is considered unskilled or custodial care. He needs help with activities of daily living, like bathing and dressing, which alone are not covered by Medicare. It's important to plan ahead. A long-term care insurance policy can help cover these costs.
You know, Linda, I think you should check with your benefits administrator at work to find out what you should do about Medicare.
I agree. I'll make an appointment tomorrow. I guess I better contact Social Security about Part A, too. I can see that making a good decision now can affect me for a long time.
You know, if you're not comfortable using a computer, you can call 1-800-MEDICARE 24 hours a day, 7 days a week to get more information.
Hey, give me a break. I've used computers since the day they were so big, the room they were in needed its own air conditioning. My cell phone probably has more memory than that computer did. Speaking of timing, it's a text from Jim. He's still stuck in traffic. Oh, and to just let you know, I've got a new laptop at home. I even set up a Facebook page. You wouldn't believe how many of our classmates have friended me to get information about the reunion.
I've received a few tweets about the reunion.
Friended? Tweets? I think you lost me at Facebook.
Poor Bob. Is technology passing you by?
Hey, I'm proud of myself. I bookmarked Medicare Options Compare and the Medicare Prescription Drug Plan Finder, too. That reminds me, I also wanted to say that the tools on the Medicare website and the Medicare and You handbook can help you narrow your choices for health and drug coverage. but you still need to contact the plans directly to get all the detailed information you need to make an informed decision.
The Medicare website also has information on preventative health services that Medicare covers to help us stay healthy.
Look right here in the handbook. There's an apple next to the preventive services. You know, an apple a day.
So Medicare covers preventive services?
Some. Medicare Part B covers preventive services for certain exams, lab tests, screenings, and shots to prevent, find, and manage medical problems. Preventive services may find health problems early when treatment works best.
I always make sure my aunt and uncle get their annual flu shots.
Medicare covers more preventive services than just the flu shot. My Welcome to Medicare package told me about the Welcome to Medicare physical exam. You have to get the exam within the first 12 months you have Part B. Oh, and this technically challenged guy used the password and instructions he got from Medicare in the mail and signed up all by himself for mymedicare.gov. It's a tool I can use to access my Medicare information, track my claims, and track the preventive services I can get. I also filled out my initial enrollment questionnaire online. It asks questions about other insurance you might have. Filling it out makes sure your Medicare claims are paid correctly, and it only took about 5 minutes to finish. I even used my Medicare.gov to sign up to get my future Medicare handbooks electronically. Hey, I'm just doing my part to save some trees.
Bob is so green.
Speaking of green, how about saving some? I worry about people who don't earn a lot or who don't have much in savings. How will they be able to pay for Medicare and their health and drug costs?
All states have programs to help people with Medicare if they have limited income and resources. These Medicare savings programs help pay certain costs, like their Medicare Part B premiums, coinsurance, and deductibles. I learned about it by watching a Medicare program on the local cable channel.
Is there any way they can get help to pay for their Medicare prescription drug coverage costs?
Yes, there's something called extra help.
There are numerous ways you can apply for the extra help. Call Social Security at 1-800-772-1213. TTY users should call 1-800-325-0778. Apply online at www.socialsecurity.gov. Apply through your state medical assistance office. Work with a local organization.
I actually get my prescription drug coverage from the Veterans Administration.
That's right. I remember you came back from Vietnam just before your wedding. Maria, will you get drug coverage from the VA since Bob is a veteran?
No, only a veteran can get VA coverage, not a spouse. I'll have to get my drug coverage from Medicare.
I feel like I've monopolized your time. It's time we got to work on the reunion. It's closer than you think. So let's put a little vinyl on the hi-fi and get to work.
Don't you mean CD on the laptop?
CDs? My new MP3 player has 4 gigs of memory.
Okay.
As Bob, Maria, Linda, and Carol illustrate, the baby boomers are aging into Medicare and have choices to make and time frames to consider. Medicare wants them to know there is a variety of resources available, including websites, publications, local cable TV programs, and even one-on-one personal counseling from their state health insurance assistance program. Up-to-date information is always available to ensure that they get the most out of their Medicare.
I've learned so much about Medicare. You guys really did your homework. I know I need to call Social Security to make an appointment to sign up for Part A since I'll still be working when I turn 65. I need to talk to my benefits administrator at work about my employer coverage to see how my insurance works with Medicare and what my health care and prescription drug options are when I retire. I need to start perusing Medicare.gov to get familiar with the programs, view educational materials, and use their helpful tools. I also need to sign up for the Ask Medicare Caregiver e-newsletter too. I know I could learn some things to help my mom with her health care decisions. I also know I can always call 1-800-MEDICARE if I have a question that I can't answer myself.
You know, I have a great idea. Don't you think this could be a topic for one of the weekend events at the reunion? We're not the only ones from the class with these decisions to make. I bet we could help people make more informed healthcare decisions.
You could even set up some computers to walk people through the Medicare website. I know I always do much better if I can get my hands on the computer and play around with it.
That's a great idea. We could use the school computer lab. And I could also contact the State Health Insurance Assistance Program. You know, they provide free personalized insurance counseling. They also help with claims and billing and appeals. I watched one of their Medicare presentations at a senior center. I bet they'd be able to help us prepare. See, there are local numbers on the back of the Medicare and You handbook. When we're done, we're going to be so knowledgeable. I bet we can go out into our communities and volunteer and help people learn more about Medicare choices and eligibility and enrolling.
I love that idea. Community service keeps me feeling connected and contributing.
Okay, that sounds like a plan. But first, I'd like to buy all you young ladies a drink.
Yes.
But you all look so young, I'm going to need some ID. Your Medicare cards, please.
Oh, Bob.
Oh, thanks, Bob.
Thank you.
To Riverdale High and the Fighting Tigers.
Yay!